Geriatric Care and Vulnerable Support Initiative, GCVSI, is a U.S. 501c3 nonprofit, non-governmental, and a professional humanitarian organization with a special consultative status with the United Nations. GCVSI was founded to address the growing inequalities and the vertical downward trends of the social determinants of health and ensuring the social inclusion of the vulnerable population, such as older persons, the homeless and refugees, and survivals of rape and intimate partners violence. GCVSI was founded by seasoned, multi-sectoral professionals to support families, communities, governments, and the international community in solving the problems of health and social service disparities, which are on the rise due to the increasing inequalities in socioeconomic status. GCVSI addresses the growing marginalization and discrimination between high-income and low-income families, communities, and amongst different demographic populations. The factors influencing the social determinants of health and social inclusion are disproportionately falling on the people we serve, resulting in rapid socioeconomic insecurity and translating into a huge gap between the rich and the poor in various communities, especially in accessing the necessary health and socioeconomic opportunities inherent in developing personal and communal resilience. We provide geriatric and gerontology services for older persons who are faced with multifactorial health and social challenges, including components of the universal health coverage, like access to medications for chronically ill older adults, elder companionship program, intergenerational programs, anti-elder abuse and anti-maltreatment programs, and womenomics program for older women. GCVSI, in pursuant of her Zero Hunger and Poverty Reduction policy, is committed in providing direct services to homeless people and refugees facing increasing socioeconomic challenges through the GCVSI food and non-food distribution, mental health, and psychosocial support programs. GCVSI's volunteers move to strategic locations like metro stations and temporary shelters to distribute already packaged food, water, snacks, biscuits, and non-food items like toothpastes, toothbrushes, clothing, sanitary pads, amongst others. Fresh food items are distributed to newly arrived refugees to ensure their rapid integration into society, while making valuable socioeconomic contributions to their host community. As a professional organization, GCVSI provide clinical management services for survivors of rape and intimate partner violence under her gender-based violence program during natural or man-made disasters. Adopting health promotion and education and disease prevention strategies, such as provision of clean drinking water in underserved communities, GCVSI is touching millions of lives around the world, promoting citizen-led and community actions aimed at taking ownership of their health and social outcome. The GCVSI Registered Volunteer Program, RVP, provides an ample opportunity for thousands of people around the world to participate in promoting a global mechanism that continue to advance the course of humanity. The Registered Volunteer Program is equally a means of impacting its participants through knowledge acquisition and resilience building for greater productivity. GCVSI e-learning training platforms help to breach the gaps in quality manpower and capacity building development for workforce. Going by our mantra, GCVSI is a sign that hope is near to the people she serves, truly represents the core values on which our organization was founded. In line with our commitment to the people we serve, we kindly invite you to support what we do, either by becoming a member of our global community or donating to advance our course so that we can touch many more lives. No amount is too small to make a difference in the lives of those in need who depend on us for their daily sustenance.